It's time for more coaching and coffee talk. Today, I have with me Eyþór Einarsson. He just graduated from the University of Copenhagen with a master's in psychology. And along with his studies, he's been working with Team NoShortcuts, CrossFit team, and some individuals on their team. And they're sending an impressive number of people actually to the CrossFit Games this year. So that's also super exciting. And we're going to talk all about his education, his philosophy in terms of psychology and sports psychology. So, Eyþór, thanks for being here, man.
Thanks for having me on. Really honored to be on a podcast. It's been a while since I was on a podcast. I actually had one podcast myself 3 years ago that I was a host. So,
see, now 3 years ago, that's before everyone had a podcast.
Yeah, I was still then. There was pretty popular. I had it for a gym that we had. We discussed fitness and interesting people. So I really enjoy these conversations and dig a little bit deeper into some topics.
Yeah. Well, speaking of digging deeper, I thought of having you on here because I saw your post on I don't know if it was LinkedIn or Facebook. They said you had just graduated with your master's in psychology of University of Copenhagen, and you said that it was interrupted a little bit along the way for your own personal psychology reasons. So talk a bit about how you got into this to begin with, this area of study, and what happened along the way, and how it may have even, I think, strengthened your skills in this area.
Yeah. So in 2015, I took 1 year of strength and conditioning program in Iceland, where I'm from, actually. And there I got introduced to sports psychology in a course. And I hadn't taken any psychology. I'd just taken business courses in my college, or in the gymnasium, it's called. So I was fascinated about psychology there. And I just told my friends, I'm going to be a sports psychologist. That's what I'm going to seek and going to do. Was actually teaching PE at that time in a elementary school level.
Oh, nice.
And so I got to do that, and it was like a online with courses on the weekend, the strength and conditioning program. So after that year, I got into my Bachelor of Psychology in University of Reykjavik. Did that, and then my fiance, girlfriend at that time, she moved to Denmark because she got into medicine. And we moved to Denmark in early 2019, so 4.5 years ago. And I had no idea what to do, and I knew that it was really hard to get into psychology here. But luckily, I had enough good grades. They only looked at the grades in the application, and I got into the master's degree program in psychology. So I was thrilled about that. Was also thinking about maybe going into some business or entrepreneurship thing in CBS. But yeah, actually, in the early it was a difficult time the first half year when I didn't know what I was going to do, and I had a bachelor in psychology, but coming to a new country, and I actually have lived in Sweden when I was younger for 3.5 years. But so we were kind of taught to not hate Denmark, but it was rival between Sweden and Denmark at that time.
There is a rival.
Yeah. Exactly.
But was the degree in English then, or did you also have to study in Danish?
I had to study in Danish as well, and that's actually one of the things when it came out. Everybody was like, Swedish, you should know Danish. It's just the same language, kind of.
Yeah.
And I quickly came to realize that it's not. At least not for me. Because I learned in school in Iceland where they need to learn Danish, but I got to learn Swedish instead. So when I got into the program, the first course I took was psychological testing, which is where we test for IQ. And I was in a group of Danes, and we were testing each other, and I in an IQ test, me in Danish, it's just below what you can be. Like, yeah, you can't score lower, I think, on that IQ test. When I was just like trying to say something, so I felt terribly bad because I was in a group with one girl who was super nice and just helped me. But the other girl, she was just plain like I was ruining her course,
Oh,
and I
geez,
felt so
yeah.
bad that I signed off that course that semester because I just felt that I didn't have the language to take it at that time. But actually, when I moved here, I started to have some visual problems or something with my vision was not as it was supposed to be. So actually, I went into some doctor research and went to eyesight tests, and nothing came from that. And my doctor ended sending me to a neuro specialist, which sent me to an MRI scanning. And that time I was kind of nervous because when I got the result from the MRI scan, I was sitting in the my lab at the where I was waiting room with the doctor, and there I could just read Huntington disease, MS
Oh,
disease,
geez,
like
yeah.
all this, like, and I'm just waiting. What have I? I'm like, what diagnosis do I have?
Yeah.
I come into the room to the doctor, and he says like, well, from the scan, we see nothing in your visual cortex. There's nothing there. Like, you are all good there. But in the front brain, you have a kind of big tumor. And I'm like, okay. And what does that mean? And he's like, well, I'm not sure, but if it's something, we will let you know. And I'm just, what? Yeah, we will send it to the Rikshospitalet or the region hospital, and if it's something, they will call you. I went home and just like told my fiance who was in medicine, like I have a brain tumor in my head, and like he said if it's something, they will let me know. So I started to have like kind of like a little bit of a panic and anxiety about that.
Yeah.
Was actually on one night I got an e-box from a surgeon from the region hospital, and then I had to sign, and it was like long list of me going into a brain surgery, and I just started to get like a panic attack. Like, why do I have brain tumor? Do I have cancer all over my body? Like, the brain just starts survival mode, and just finding what's wrong. So I actually start seeing psychologists there, because actually when I went to see the surgeon, she told me that it was most likely not a bad tumor, or we call it that, like that spreads.
Malignant, yeah.
Yeah, malignant. Yeah, it was not that. It was benign,
Benign,
most
yeah.
likely. Yeah. But she wasn't sure
Most likely.
most likely, not certain.
Yeah.
So the brain always expect the worst.
Yeah.
When we go into talking about the brain and anxiety, it's like if you tell it a small percentage, the brain is gonna think that, or at least the anxiety is.
Yeah.
So I went home and just had a little bit of like a crash, and I called my then psychologist that I've been working with before on a bit. So I went into kind of exposure therapy where I had to for 3 months, because she ended up taking me for like before and after the MRI scan. So she thought that it was not something that she would remove now at that time, but wanted to have like constantly being taken MRI scans to see if it would be growing.
Yeah.
And I went the last 3 years, I've gone to like 8 or 9 MRI scans. If I push forward, actually, I ended up in middle of my internship now. And 2 months ago, I actually got a call from my doctor, and I got in, and then it had grown. So actually, I planned a brain surgery on Monday. So I need to do remove it.
Oh, really?
Yeah.
So this
So it's
coming
actually,
Monday, you're having brain surgery?
yes, sir.
Oh my goodness. Wow.
But I'm in much better shape now with it than I was 3 years ago, because the
Mm.
3 years ago I had health anxiety, and health anxiety it's really, really uncomfortable, because if you like, I was, yeah. You must be relating, because I mean, you have had a heart attack, which is, I can imagine you live by constantly threat of maybe having a heart attack again.
Yeah.
So it, for the period that was uncertainty, I had it, but when I got the confirmation that it was benign, my symptoms stopped. So I didn't
Okay.
have anxiety, it's health anxiety from there, and I haven't had it since. And I haven't had it, like, for now. I'm really calm, because it's stationary here, and I have the best surgeon in the country gonna do it, and I'm in good hands. So I'm not having the same amount of anxiety that I had before. So that is good. But so that is kind of my story with anxiety, most part. But there was also some things that happened that led me into depression, that during my studies as well, that was much scarier than having a brain tumor, I felt, or I
Yeah.
feel. And is that is the story of me doing extreme burnout, and
Mm.
going into a severe depression during my internship. And I was having my thesis. Actually, if I go back into the 2021 end of the year, I was finishing my thesis. And I'd actually been doing my studies from then on 2.5 years. Usually master's is 2 years,
Mm.
but I've been working alongside my studies. And because my fiance is doing medicine, I wasn't in a rush to finish my studies, and I'd rather just relax a little bit. And I had skipped some courses because my Danish wasn't good enough, so I
Mm.
waited a little bit. So it was kind of planned. But there's a rule in University of Copenhagen that you can only be 3 years with your master's degree.
Yeah.
That is the maximum time.
Yeah, I'm also
So
there on a master's degree. I don't know if you know that.
yeah, I knew you
And I
were.
took an extra 6 months. So I'm also on a kind of a timeout because of depression that I have. But I'll talk about that later. But yeah.
Okay, that would be interesting to discuss it. But what are you studying?
Mine is a master's in integrated food studies, it's called.
Okay,
And
interesting.
there is a little bit about nutrition in there, but it really is like different different kind of categories melded into one,
Mm.
different things about food. But we really focus on, you know, how food is, you know, made and circulated throughout the world, the whole food system, which is, you
Mm.
probably, I don't know if everybody knows this, like, food system map that they put on.
Yeah.
It's like your first day if you get any kind of master's in food, and you just see this complicated food system, and you just think, this thing is so fucked. There's no way we could ever do anything to improve it. But
Yeah.
this is what we're trying to do. We're trying to make
Yeah.
things more sustainable, trying to
Okay.
um, and to that end, you know, there's some nutrition in there too, and trying to focus on these things where the food system goes wrong and is like adding to chronic disease, and is causing a lot of waste that you know, the planet can't handle anymore. So
Okay.
we're kind of tasked with that impossible job of improving the global food system.
Okay. Interesting.
Yeah.
That's really interesting. Um, so you're having an off time now from the studies, you're saying?
Yeah, I was well, it's interesting what you said. I really identify, because you said, well, you had this brain tumor, but it really was the depression that really kind of put the fear in you. And
Yeah.
I've had that too. Of course, with a heart attack, with my heart attack, you know, my heart stopped. So
Yeah.
my heart stopped for a little over 40 minutes. So
Yeah.
that is
Wow.
like, you're always walking around with that idea, and like you said,
Yeah.
you're waiting for it to happen again, So I
Yeah.
had this kind of anxiety and PTSD after the
Yeah.
heart attack. And so that was one thing, but I really also kind of have struggled throughout my life with depression at various times. And
Okay.
I've always done a whole lot to try to treat it
Yeah.
naturally, like doing the hot and cold exposure, and through
Mm.
exercise, and through nutrition, and through meditation, through spirituality, prayer, whatever,
Mm.
that I've been really working. And then I really realized, okay, I shouldn't have to work this hard to like not quite get up to the average person. I'm working really
Yeah.
too hard and feeling not so great. And I've
Yeah.
always been against taking medication, because I have a
Yeah.
background too as in recovery, as an alcoholic and drug addict in recovery. So there's just
Okay.
the fact that there's a pill that could be part of the solution. It feels like
Yeah.
this kind of slippery slope to me, because I'm
Mm.
like, no drugs, no alcohol, for 20 years. Um, so
Yeah.
so there was that, but yeah, so I was living with this PTSD, and like you said about waiting, could the heart attack happen again? And of course, statistically, it says there's a good chance that I will have one, within 5 years. Now I'm at the 4-year mark. But of course,
Okay.
I'm not your average heart attack survivor, um, but I really identify with what you said, that the depression is what really got you, because
Mm.
I just went through a period when I was working on the thesis, my master's thesis,
Mm.
and I think part of it was being away from school and suddenly feeling very isolated. I
Mm-hmm.
really like the camaraderie of being in class and stuff like that. And like, how it is when it's thesis time, it's boom, you're on your own, kid. And so
Yeah.
that didn't feel so great. And then suddenly I realized I can't do this. I'm
Yeah.
really feeling bad, and I was having some, suicidal ideation. I was
Yeah.
thinking, oh, what's the point? I'm almost
Yeah.
57 years old. Why try? I've
Yeah.
already died once already. I'm doing all these negative chats
Yeah.
in my head.
Yeah.
And then it was really my partner that said, you got to see someone about this, because
Mm.
it really was affecting my whole family. I have three young kids too. So
Yeah.
and I could see that. I could see that.
Yeah.
Everybody was like, "What's wrong with daddy?" And
Yeah.
so that's what led me to do something about the depression, and to be open to going on medication. And
Yeah.
it was like, they say like antidepressants could take like 2 weeks to work or whatever.
Mm.
Within a half hour, I felt it. So,
Okay.
and I think it's part of, that my brain chemistry was so off.
Yeah. 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 Wow. It's really
Yeah.
really interesting and good to hear that they worked for you, because I don't have. I am actually been on depression medication for now about a year,
Mm,
and I don't think actually, if I go into the story, maybe because it's a little bit of a background story of my depression.
mhm,
That it's like an extreme burnout that ended in severe depression. Because in the end of 2021, I was finishing my thesis, or I was supposed to finish my thesis, because that semester I had been writing it alone. Like you said, you feel like isolated.
mm,
You this hard, long process of doing the thesis, and I wrote a topic that I really enjoyed. It was about mental health and remote work.
mm,
So it was a topic that I really enjoyed. I've always been like a little bit of a high achiever, and school for me has been something where I've thrived in.
mm.
And I actually got published my bachelor thesis in a
Wow.
journal. So I felt a little bit of a pressure to do a really good master's degree or master thesis, but I struggled. I really struggled, and I have struggled with writing. writing long text. Writing an article is not really long. It's maybe 6, 7, 8, 10 pages max. But for the thesis, it's like 60 pages. And I was really struggling with having it so long, but it didn't need to be that long. And I actually had a thesis that I was comparing myself to, which was really good thesis by a guy who wrote really, really well. But yeah, I went there on a working trip. Actually, in end of December, I decided to do a working trip when it was actually supposed to be my deadline. So I didn't finish my thesis, but I only had the discussion part left of the thesis. So it wasn't that much. And I was a little bit nervous about my internship, because internship was supposed to be my final 6 months of my school, where I was supposed to gain practical knowledge about psychology. And I got into a company in Norway, decided to go away from my fiance at that time. We were only two. Me and my fiance living together in Copenhagen. So I decided to go to an internship in Norway that January, and also having my thesis on, like, I extended my period of 3 months of my thesis. That was fine by the supervisor. But I had really lost appetite at that time, and I had lost a little bit of weight as well. And I also was struggling a little bit with work. When I was working, I was really stressed. I was always having this anxiety regarding work, which wasn't not really stress. It shouldn't have been that stressful. I was doing work with media, with like the NoShortcuts, like it wasn't stressful, but still I was getting aroused from it. But when I went to the internship in Norway, I rented a small room with 2 other Norwegian guys. It was like a downstairs, not a basement, but like a downstairs room. And it was close to another guy, and there was just thin wall between me and him. And I started there an internship, and the internship was pretty much just not really learning. I was just working from 8 to 4. And from the beginning, I didn't sleep well, because the guy who was next to me renting, he was playing video games all night. So I had to sleep with earplugs in my ears, and I had just slept terribly. And I did not feel well in the internship. And when I was working, I didn't have any energy left, like after work, to do the thesis. So I had to work all the weekends on my thesis. So I had like no break for 3 weeks, trying to finish my thesis. And I really struggled with my thesis. It came down to me, I was doing in the internship, I was doing a presentation for seamen about depression and PTSD and just stress. And I was reading this about depression, and I just hit every single diagnostic. And I was just like, it's like not eating in like appetite up or down, sleeping, and more or less. I was sleeping less. I was not waking up by the alarm clock. I just woke up 5 o'clock, like ding. And I talked to my supervisor at that time and just said, like, I'm having all this, or actually I got a call. My girlfriend came to my birthday there in Norway. And when she left, I started crying. Like, I felt so bad when she was leaving. She came for a weekend to enjoy Norway with me, and I felt so terrible. I started just straight out crying I felt bad. And when she got home, she called me and she told me she was pregnant. And I'm in Norway doing my internship, working like no relax, just working on my thesis and doing this internship, feeling terrible. The company that did internship with, they actually have a lot of people working from home. So I was allowed to go back to Copenhagen for my 4th week and working from home. The stress was still there. I was waking up like with no alarm clock, 4 or 5, still having my thesis. And my fiance and me we were like, is this the right internship for you? Because I felt stressed to perform at the job, and I was not really learning a lot, I felt, in that internship. And still I was not feeling that I was finishing I thought I was going to fail my master thesis. Thought I was going to fail it. Like straight out, I felt it was horrible that I was writing. So it was now the 4th or 5th week, and I go to the school and say like, hey, I'm not really thriving and in the environment, and I'm actually having really hard time. And the supervisor from my school says like, you're obviously going through depression and you should do sick leave. And I could not imagine doing a sick leave, because that meant, because we were expecting a child in November, that meant I had to like take 1 semester off and then do the internship again. And in between that, I needed to pass my thesis. So I had to prolong my study of 1 year, which was not, in my mind, the right move at that time. So I just keep pressing me forward with it. And I asked him if I could move to an internship in Copenhagen, which he said, if you have a place, because we were already 5 weeks out of 14 in the internship. And I call up my friend of mine, psychologist, Icelandic, and ask him, hey, can you take me in and we do something, do an internship with you? And he's like, yeah, fine, let's do something. So I switched there from being in Norway, come to Copenhagen, and I started to work with my doctor here in Copenhagen, which is just downstairs, like the home doctor you have. And he had at that time given me sleep pills because I wasn't going to sleep and I was waking up way too early. So my sleep, I was only getting 3 or 4 hours a night and waking up in sweat. My nervous system was just blown up. And I kind of hid it also because I did not want to take a sick leave. That was just, to me, that meant 1 year, you need to do it all over again. And we started to do this internship with my friend who is an Icelandic psychologist, and he takes 1 week off. So I had to take 1 week off before starting. I had been put on antidepressant from my doctor at that time. So we were waiting for that to kick in. But I was in such an aroused state because everything needed to be finished, and I was trying to, and my horrible thesis was there, and I was just losing control of everything. And that is the time I also got suicidal ideations from the sleep of 1 month being sleepless, and I hid that as well. I did not know, because I had asked my supervisor, do we have patients with suicidal ideations? And he is like, Eyþór, so that is one symptom of having depression. And I was like, oof, so you have people with suicidal ideations. Like 2 weeks after I asked him that, I am having suicidal ideations, and kind of extreme. Like I was having them constantly. So with that said, I just did not think that it was ethically right for me to have patients doing interviews as a psychologist while I was having suicidal ideations. So I had lost appetite. I did not eat. I couldn't eat anything almost. I was 63 kilos, 62 or 63 kilos. Like, to comparison, I am 87 now. So I dropped many kilos. I didn't sleep. I was having suicidal ideations. And my fiance was there, like, pregnant. It was not the right time to seek psychiatric help. So, but I did it after I called and we talked to our doctor. She said that I needed to seek psychiatric, acute psychiatric help. So I went there with my fiance, and we did not know what to expect. It was a night. It was a Friday night, I think. There was like, this is like 6 weeks into my internship, and I'm like I need to finish this. I can't stop. It was just and I didn't know what to expect when I went into that interview. But we went into the acute psychiatric help, and I was telling the doctor about my symptoms, and he just said, like, you're not in a condition to go home. You need to come in with me.
Wow.
And I've actually I've been really afraid of hospitals and doctors in my life, and had the health anxiety from having the brain tumor. Because I got, like, when I was little, like, went into accident with my nose. I went to a fan that my nose broke here. So I was like strapped down, like 2 years old. So my memory of white,
Yeah,
what do you say?
it's in there somewhere. Yeah.
Yeah. So like I get really aroused when I go into hospital. So, and I'm like really nervous. And I asked him, like, how long do you think I need to be in here? And he's like, about 6 weeks. And for me, that was just, I like one, I thought I was never going to go out there, because I had, in my mind, my way, it was doing a suicide, because the suicidal ideations had been that extreme, and that, so it was either going in there or I wouldn't have. Yeah, I just needed to go in there. That was just the only solution at that time, because I didn't eat, I didn't sleep, and I was having way too much of suicidal ideations. So the first meeting with the doctors, they recommended ECT therapy, which is electroconvulsive therapy. Which, do you know about that? Have you heard?
Yeah, like electric shock.
Yeah, electric shock. Yeah, while you're under anesthesia. So that is what they did. They started medication and started the ECT, and that did wonders for me. I couldn't have imagined that. They said also to me, like, this would be like restarting your brain. And I was like, did not really buy into it, but I just said, like, everything I can get help with, I need it. Like, I was in such a bad mood. 2 months of 1.5 months of almost non-sleeping, not waking up with an alarm clock, and not losing this many kilos. And I just thought that there was, this, or I'm gone, pretty much.
Let
But
me ask you a question too, because I'm curious if this was, I can imagine that this was weighing on you too, because this is what happened to me too, is the externals of my life. There's no reason to be depressed, like all my kids are doing great, my relationship is doing great, and it's like I'm finishing up a master's. I was looking around for a PhD, and I was doing well in school, and everything was going well.
Yeah.
But also there was this thing of too many things going on at once, and it was just like I just hit a wall, but you couldn't point to it and say, oh yeah, this external circumstance sucks, this is happening, I can understand why you're depressed. I think other people would look at me and say, wow, it looks like your life is pretty nice, here in Denmark.
That's a really, really good point that you come up with, because when I sit there with the first meeting with a team at the psychiatric ward, I say to them, I have the perfect life. I have a fiance that I love, and have a really good relationship with. I have both my parents. My wife, or my fiance, has lost both her mom, and she's not in contact with her dad, so she's lost both her parents. So, like, and I'm healthy, like, I'm young, and like everything points to me not having depression. But the workload and the external factors that I was in just made my brain in that state of not wanting to live. When we like do not have those factors, like, especially not me, with because I was diagnosed with severe depression, and I hit like a 32 out of 50 in Hamilton test.
I got you. I got 40 out of 50.
You got 40 out of 50. Okay. I think it
I
was
was gonna say that too.
30.
I'm trying to do, get A's all the time in school.
Oh,
But I
yeah,
really
wow.
aced the depression test.
Yeah. Okay. Yeah. Wow. Yeah. I think I was in the high 30s somewhere.
Yeah.
And it's I can't remember how high it goes, but yeah, definitely then we were both in the severe scale
Yeah.
of depression but yeah, that's my story, but these ECT therapy helped me go from that state, and being within 6 weeks I was having non-suicidal thoughts. I never like, there was also something they asked was like, do you have a plan? And I never had a plan. It was just daunting on me that I needed to go away from these thoughts, and I needed to go away because I was constantly thinking, I want to have a heart attack, I want to die. Like, just take me. When I was in a flight to Iceland,
That's exactly how it was for me. I thought all this time thinking, am I going to have a heart attack? And I was at the point where I was like, just let me have my heart attack in my sleep tonight.
yeah,
And that's it,
yeah. But it's suicidal ideation. Even though I've studied psychology, for me, having those thoughts by yourself, and for example, I did not seek help at that time with psychologists because I just thought there was no cure for this. I really thought that the only way out of this pain was to take on my own life. There, I was just at that point because, yeah, it felt hopeless for me. I was never gonna wake up with an alarm clock. I was never gonna wake up not in a panic attack, and I was that depressed that in that state you don't see a way out.
No. Yeah. And it's also tough because I think unless you've been there, it's so hard for people to comprehend.
Yeah.
It's like you can't just like turn to your friend that's never been depressed before and say, well, it's like this. Like, you really can't comprehend it unless you've been there.
Yeah, it's 100% that way, and that's also why I wrote that status, and it's like, it would have been easy for me to just say, hey, I graduated with a degree from University of Copenhagen with psychology, and I could have easily left out that I was struggling with this, but it was just, I felt that. And I also had in my new internship, which ended up being great, actually, I did the internship again with a psychologist and ended up having 14 weeks of great learning experience. I got to see him in therapy. I had 11 clients in therapy. I have still clients from that sessions or that internship period that I'm still have now going on.
Yeah.
So it was just, I feel like a psychologist now. Like, I wouldn't have felt like a psychologist after the internship in Norway because I was not learning. I was just working. So that really, really was a great way for me also to get better. And I got so much interest in the mind of suicidal behavior, like depression, anxiety, PTSD, like all these things, like you're saying and you've experienced. I just felt in my own, and I really have much interest in working with the clinical psychology, because actually my studies, I focused on work in organizational psychology and had like a B, what do you call it, like major and minor. I had a minor in clinical psychology and major in organizational psychology.
Okay.
So my courses were mainly from that, and because I wanted to work with teams and organizations, but now I went into a clinical internship. So, and I'm really thankful for that, because having that experience of working with people, I think will be the next step for me. Because, like I said in the post, I'm gonna try to go independent, because I'm also not really good in Danish. I can speak it, but I can't take clients on at the moment in Denmark, and Danish speaking people. But we actually have quite a lot of Icelandic speaking people, and through the internet I can take Icelandic clients as well.
Let me interrupt you for a second, because I just want to thank you
Yeah.
saying that when you were on social media, and I wanted to thank you for talking about your own depression, because I think too, for me, well, I felt this situation where I was, a personal trainer who had a heart attack.
Mm.
It's like,
Yeah.
you don't want to put that at the top of your resume,
Yeah.
personal trainer, number one, had a heart attack, number two,
Yeah.
kettlebell training.
Yeah. Yeah.
But when I went through my education here in Copenhagen with global nutrition and health, and one thing you can call yourself after that is a health coach. So I thought, well,
Okay.
I'm gonna transition into health coaching, call myself a health coach, because then, you know, having a near fatal heart attack is actually useful.
Mm.
I can speak to other people with chronic disease, with PTSD, with other psychological conditions, with absolute authenticity, of having
Mm.
gone through these things myself. And so I really feel like it's strengthened me. But then when I went through the depression thing, I felt like, I felt like a fraud, because it's like I
Mm.
teach all these people how to, do hot and cold therapy, to manage
Yeah.
stress, breathing, meditation, all these things that I post about all the time, in addition to exercise. And then
Mm.
I'm like, and by the way, I have to take a pill for all this shit. So I felt a bit
Yeah.
like a fraud. But then as soon as I started talking to people about it, I don't know if you've had this situation too. As soon as I opened up about it, then you find out, wow, there's so many people around you that, oh, really? Me too. Da, 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 da. Oh, yeah, me too. I'm on this. Da, da, I'm on this. And so,
Yeah.
and
Yeah.
then I've had people also thank me for talking about it, because still there is this stigma, about mental health.
100%.
Yeah.
I I couldn't agree more, and I think that is also why I was a little bit hectic of putting it out first. Then I just thought, like, why should I help the stigma grow? Like, I
Yeah.
want to break down the barrier of, like, I needed to take a sick leave from school because of mental health issues. And like, did that different from me having to, if I had to do the brain tumor in my studies, then I would have a physical like illness. Like, for me, even the mental illness is even much harder when you are studying.
Mm,
Like, I can take my brain tumor and it can be cut away, like, and that is gone. Like,
yeah.
depression, that is still I'm working on.
Yeah.
It's something that I will probably have to have the rest of my life. Like, I have to accept what happened to me. I have to accept that I had times when I did not want to live, didn't see the point in life, and I even that, because the brain is. I felt a little bit after that burnout I had that I've had a year, because the last summer actually I thought, because I had ECT and I had medication, and I felt almost last summer like I was my normal again. And
Mm,
then actually this winter I struggled. I struggled a lot, and I was waking up with really bad thoughts, and my nervous system was still reacting even though I was on medication.
yeah.
And that's why I say my medication did. I'm on medication now. I don't know how much it's helping. Um, I feel still that I have a long road ahead of
I
working with the
always say,
depression.
if you're not sure how it's working, just ask your fiance.
Yeah, yeah,
He said, "Oh yeah, she knows it's working." That's how it is.
yeah,
With my partner. I'm like, I'm not sure if this is working. She's like, yeah, it's working.
yeah. But do you have different, like, because my depression, I have it worse at the morning. When the
Mm,
day comes up, like, I get lighter and lighter, and in the evening I don't have, like, almost symptoms of depression. Some
I'm
have
the
it
opposite.
different, the
I'm the
opposite.
opposite. Yeah.
Yeah.
Yeah. In the
Okay.
mornings, I'm much better, because, but I also have this thing that since I had the heart attack, and I don't know if it's decreased heart function, because when they look at me with ECG, you can't even tell that I had a heart attack anymore. You can't see the scar
Oh
tissue
wow.
on there, which usually you can with someone that had a heart attack. And I did have
Yeah.
a scar tissue. So you can't even see it on an ECG anymore, which is pretty remarkable. But I still had, waning energy as the day goes on. By 2 o'clock in the afternoon, I'm ready for a nap or 2 or 3 sometimes. But now because this medication that I'm on is so effective on the PTSD part and on anxiety, that I'm not thinking about that anymore. And so I think that saves a lot of energy too. Because when something like that happened, there's a part of your brain that's always working on it, I believe, and it takes up a lot of energy, So yeah, I'm usually good in the first part of the day, but also on the first medication I was on, I've been on it for 2 months, and then I just kind of hit a wall again and again, and don't know why. But sometimes the
So you had to
medications
change.
just stop working,
Yeah.
and so they put me on another one, and now that's working well too.
May I ask what? May I ask what the type?
I'm so bad with these names. Duoxetine.
Duloxetine.
Yeah. It's a
Duloxetine.
serotonin
Okay.
reuptake inhibitor and
That is just. I actually was on that as
neurotransmitter.
well.
I mean, not
I was
neurotransmitter. What is it?
SNRI.
Yeah.
Yeah, I
But
was on that. I actually had to change recently.
my daughter's name.
Ah,
Yeah, no, what is it called? Not adrenaline, noradrenaline. Also,
noradrenaline.
noradrenaline reuptake. Yeah.
SNRI. Okay, yeah, I was on that for my longest period. So I recently changed as well because I was not doing that well. They wanted to change to another type of antidepressants. So I've been doing that now for about 2 months, and I feel better, but I still feel that it's accepting part of, like, I lost so much confidence in me because I went so low in my life that I thought I would never go to that place. And because I still struggle in the mornings, of just, and I that the symptoms of me is like, I eat well, actually. I sleep well, because I also have like some medication to help me with sleep now, as well. It's not like a sleeping pill. It's just helps with going deeper into sleep. So it's strange to still be kind of struggling, because I'm finished with my degree, but my brain is just on the lookout. Like, you're not going to do well. You're not going to be independent psychologist. You're not going to have work. You're not good in Danish. Like, negative thoughts are just like, which is the symptom of depression. And it's like, yeah, it can be daunting, and you just want to go to sleep. Sometimes I take a nap just to get into a dream zone, because I just want my thoughts to turn off. Because sometimes when I wake up in the night, I was like, when I was dreaming, I was not having those thoughts. I just want to go to sleep again. Like, it's, and
I think personally, I mean, if I was looking at trying to pick out a psychologist, and if someone was courageous enough to actually write there, I experienced it myself, I would pick you every time, just with my personal history.
Yeah.
So I'm really happy that you decided to talk about it, and I think it really is I really believe that it's a huge plus in terms of your career. And let's talk a little bit about sports psychology, because I don't know if I ever told you that I started off early in life as an athlete. We had something in the US called the Marine Youth Physical Fitness Test, right? It was push-ups, pull-ups, sit-ups, standing broad jump, and the shuttle run, all on a point system, right? So it was like CrossFit before there was CrossFit,
Okay.
all body weight stuff, calisthenic stuff. And so we had state championships, regional championships, and then there was national championships, right? And so I went to nationals 3 times when I was a kid, the last 3 years of high school. And the last year of high school, I won the whole thing, individual champion, and I set a record in it that held for 27 years.
Oh, wow.
And so I had this thing of like, I'm a champion athlete. you know.
Yeah.
And I think there is a lot of, I'm just wondering what your experience is with like the psychology of someone that is a champion athlete. Because I mean, for me personally, it didn't come from a good place. You know, I think it
Yeah.
came from, you know, an insecure attachment with my mom, need to someone please look at me and give me adulation and these kind of things, you know, that it was fueled by. So it's weird that it was not a healthy thing for me. And then once I was this champion athlete, there was a part of me that thought, and I'm going to be a champion for the rest of my life, you know?
Yeah.
And so then it's like, oh, this is not a, you know, being a champion, that's not a sustainable thing. And I felt so great about that. And then I entered the real world where, especially going to college, where I was one in a sea of thousands, you know, and I was like, but I'm special. No, not anymore.
Yeah. Yeah.
And because I mean, and that type of thing you can kind of lay across any championship athlete's experience, I think, you know.
Yeah. Yeah, like you mentioned sports psychology. I like in the recent years I've been working, or in the internship I worked both with athletes, or it was about three or four athletes that I work with in the internship. But I'm the type of, like, my way into sports psychology is to doing clinical psychology, and I'm really interested in that because, like, if you learn sports psychology, like in the UK they have programs, in the US they have programs. It's about optimizing athletes, it's about self-talk, it's about visualization, it's about motivation, it's about all these things that are not so clinical, in the sense of working with athletes in that way. But I've really enjoyed that part because that is also where I want to go, and part of my business is actually working with athletes, and we test them with a 64 questionnaire about test of mental performance. No, sorry, it's called TOPS, test of performance or mental performance test. So that is 64 questions that screen you for what area in like self-talk, visualization, and goal setting and all those things is, and then I would take interviews with them to see where they stand, and then actually which I use in therapy. It's called acceptance commitment therapy. Have you heard about that?
No.
So the third wave of psychology is like cognitive behavioral therapy. Maybe you've heard about that.
Yeah.
So the new wave is coming, which is a little bit more dynamic therapy, which is called acceptance and commitment therapy. And there are also other therapies in that realm, but I really have attached myself and read in my internship a lot about that, because also I've been attending the Sports Psychology Committee of Denmark. They actually recommend that you use ACT with athletes. And then we were actually using mindfulness, and we're using acceptance, we're using commitment of values living. So I really enjoy digging into that therapy form. But maybe I'm going a little bit out of your question, because your question was into how to work with.
I mean, I think you're getting into it because when you're talking about taking a clinical psychology perspective with athletes, I'm just because I'm just thinking, like, first, I mean, what I find is when I had a certain experience, probably a lot of other people had that too. So these kind of athletes, like I was then, and I still have it today, are very hard on myself. You know, a lot of like punishing self-talk, and a lot of the training that I did just as a competitive masters CrossFitter, you know, was really punishing to myself. Like, you got to do this, you suck at this, put it in, you know, and all, you know, coming from a very negative place. But I think that was really from really early in childhood, and parental
Okay.
attachment, and
Yeah.
complex PTSD from that. And
Mm.
so yeah, I'm just wondering, and, well, also, and just with your experience with burnout, because I can see, I'm always looking at these athletes, that are going to go to the CrossFit Games, or the ones, you see
Mm.
at Butcher's Lab or where have you. And I always get
Yeah.
nervous when they get that look in their eyes with the dark circles under their
Yeah.
eyes, and they're doing all this
Yeah.
stuff, and they're eating all this stuff. And I just look in their eyes. It makes me nervous because I feel like they look like they're really stressed and really worn down.
Yeah. I mean, definitely, like, you take a sport like CrossFit, which I actually love to work with athletes inside CrossFit, because that sport I was actually coaching and know pretty well. And that is a sport where you're putting stress on the body and the mind a lot through the day. And you need to recover. Like, if you're not training, you need to be thinking about recovery.
Mm.
And even, like, I've worked with one athlete that had to take, like, school off because there was just so much stressors in that athlete's life. Then I needed to help that athlete make a decision that was to either cut down training or cut down school. And because the stress was just too much, there was just no way. The symptoms of that was just going to lead into anxiety and depression.
Mm.
So it was that's also why when you were saying that you were saying that you wanted to choose a psychologist that had gone through it, I was really ashamed at first that I had to be admitted to a psychiatric ward being a psychologist.
Yeah.
And I thought that, but actually, when I worked in the internship, I think, and I actually have now a client at Thor that is still with me, that I told a little bit my story, and I used that, and she has gone to 2 other psychologists, but she didn't get the same feeling because she is struggling with depression, and I can relate to her, and like can relate to her suicidal ideations, and that has actually become on my arsenal a little bit in my internship. So yeah, I think that, like, you asked a little bit answering maybe your earlier question there with how I use it. My experience, it has really become my arsenal, and also motivation.
Yeah. And what do you, I mean, maybe you can't, this is too general, you can't answer it, but what are the main things that you see with, for instance, CrossFit athletes? What kind of things do you most normally have to work with them with?
It is that this sport is, you need to take everything seriously. Your nutrition, your stressors, actually, I would say, to be aware what is stress and what is not stress. When are you in your sympathetic? When are you in your parasympathetic nervous system? Understanding that, because, like, for example, if you take unexperienced and even experienced athletes, they're at the games, which is, not only are you putting stress on the athletes through the events that are happening, but you have briefings, you have the arena that is loud, you have so many stressors putting on an athlete's body that you need to be really smart. And the smartest athlete, they are not in the warm-up area the whole time. They're not going to watch other heats. They are there to go in, do the event. They're out. They have their headphones on. They have to relax, even take a nap. So it's really understanding, both in the competition setting and in the training setting, how are you stressing your system and how are you recovering your system.
Yeah.
And that can be a little bit individualized. And I think that the younger athletes, and I've worked a little bit with under 20 years old, and I'm actually now gonna work a little bit with Icelandic weightlifting team, which I've done before, because I love working with weightlifting as well, because there you can yeah, you have 3 lifts, and there's a
Big
lot of
mental game. Yeah.
big mental game. Yeah, yeah.
Yeah. I've done one weightlifting competition too. So yeah, it was
Okay, yeah.
because most of the day is sitting around, like you mentioned. It was very hard to, okay, I'm down, let me conserve energy. And now, when to ramp up, and get ready.
Exactly. And you see, actually, one meet I was on, the weightlifter was between when he was supposed to be sitting down resting, then he was hiking himself up. And I just like, you don't understand that you need to be using that energy through the lifts. Now you're supposed to sit, get into, not be aroused. So that is, in a simple way, what I try to work with athletes. And of course we can go down to visualization, self-talk, and different areas of psychology within that. But it's mainly like, if I answer the question, it's about understanding the system, and also the brain. The brain is not made to make happiness. It's made to actually see the negative sides of things. It's more convenient for the brain to see the negative side of things than the positive side of things. And this comes a little bit into acceptance and commitment therapy.
Yeah, maybe it's less work. Maybe it's less work for the brain.
No, but if you think back on the Stone Age, we needed to warn ourselves about the other people that were gonna come and take our food and
like fight or
we
flight,
needed to warn.
Danger. Yeah,
exactly. And we needed to compare ourselves to others to get healthier and to get fit, and we're comparing us to other, and so the evolution is also, we have inherited a flawed brain in a sense that is not supposed. It's called The Happiness Trap, one book that I read on it, and I recommend to you, because it's like a pop cultural book about acceptance commitment therapy. A great book about the trap of happiness, that we are not actually made to be happy, or constantly happy at least, and suffering is part of life. And that has helped me a lot with recovering from depression. I've read a lot into this philosophy and science of the brain and how we are wired. And I think when you accept that feeling of in the morning, maybe when you're depressed, that these are just thoughts. We don't need to attach us always to the thought. We can have that thought, but can let go. That is kind of the mindfulness of it. So cognitive behavioral therapy would say, what is the alternative thought? What is the logical part? But when the brain is working, it's not working in the logical way. It's in the fight or flight mode. It's in the reptile brain. So that is fight or fight.
Yeah. Like
that is not
base
logic.
Instincts, like
Exactly. And there is where the depression comes, where the anxiety comes from. So we're working with different part of the brain, and I actually had to work with. This is a story that I had to work with. I can't remember the word in English. It's like sygeplejerske.
Oh yeah, nurse.
Do you know that? Nurse. Yeah. Nurse, and she was in the after therapy that I'd gone through, and she was telling me that I should not have to worry so much because we don't live in a war zone. We live in Denmark. And she was kind of telling me that I needed to think more positively.
Yeah.
But she was speaking to my logical brain, not my reptile brain that was actually depressed.
Yeah.
So, and when I said this to my psychologist, she was just, and both the psychologists I've talked to, they were like, she really said that to you? Because that is just, she does not understand how the brain works. It's like, you can easily
just make a decision.
Yeah, it's like, I have a great life now. I have a boy who is healthy. I have a great fiance. I have, like, I live in Copenhagen, and like, there's so many things good in my life, but my brain when he wakes up, is still warning me about all the things that could go wrong. You don't have work yet. You're independent. You're going to go independent psychologist. Like, all the negative just warns me.
And maybe we've been going for over an hour, so I don't want to go too long. But what about if we close with just some practical advice? Like, if you wake up like that, what's your go-to thing to head yourself in a better direction mentally?
So this is actually a really good question, because just yesterday I was with my psychologist and we were working on the things what are the things in my life that I can calm myself down and work in the parasympathetic nervous system. That is actually going out in the nature for me. I can go back and there's trees, there's birds. I need to take a stroller with my kids. I need to look around and be in an open space, because being in an open space, you're telling your body there's not danger here. And being in the nature. So that is one thing I do, is try to go out and take a walk. I also try to listen to a podcast that also takes my mind into a different mentality. Being in a therapy session or in a conversation like we are having, then I'm in the now. Like, the more I'm in the present moment, when I'm not in the past and when I'm not in the future, then is when I'm at peace, or when I'm at a really mindful, feel good state. But as soon as I get into the, whoa, what happened there, or what is coming, I start to get anxiety and depressive state. Do you relate to that?
Oh yeah, totally.
Yeah. So
I mean, I love that about the getting in the cold water, which I've done for 3 years now, and it's such a big help, but it does wear off after a couple hours, and I can't keep, I can't go in the cold water 6 times a day,
Yeah.
But yeah, so I do that. I do breath work. I do, I also change my workouts now, where I do these small workouts throughout the day that give me a little boost, rather than doing it all in one big session and then the rest of the day, so that helps me. But Eyþór, thank you so much for talking like this, man. I mean, I could keep going for another 2 hours because I'm fascinated by this stuff, but I really think it's awesome that, again, that you talk about your own struggles with mental illness, and I totally think it makes you that much better of a practitioner, for sure. And do you have? We'll put it in the podcast notes here, a website or something if people want to contact you and hire you. Yeah. So we'll put that all in there. And yeah, man. And good luck. I had no idea that you're going to have this brain surgery next week, and good luck with that. And I'll check in with you after and see how you're doing.
Yeah, thank you so much, and maybe I'll do a cold exposure with you sometime. That'd be great. That'd be cool.
Yeah. All right, man. Thank you so much.
Thank you.